patients are very narrow in their focus. They're very narrow in thinking that I'm coming in here for migraine headaches, that must be what this doctor treats. So there has to be different ways for your patients to see that there's so much more than just migraines that you treat in the office. Welcome to AMC. I'm Dr. Greg Miller. Have you ever taught your patients how to tell their chiropractic story? Today, I'm going to share with you some tips on how to do so. Don't miss my advice on how to display these testimonials. If this video is useful for you, please click the like and subscribe buttons. Let's get started. Hey doctors, it's Dr. Greg Miller with you again here today. We are going to talk about referrals. Let's call it Their Story is Their Glory. They, of course, being your patients. Every patient under your care has a story. Doc, they have one when they're under the acute phase of care in your office. They have one when they come to the end of the acute phase of care. They have one as they go into lifetime care in your office, and certainly as they experience lifetime care in your office, they continue to have a story to share. But are they sharing it? Let's ask a couple of questions about that. Number one, do they even realize that their story is important? Do they understand the value of sharing their story? Not only for the person they're sharing it to, but also for themselves. That's a whole nother video, but it is incredibly important for patients under your care to share their story. I would go as far as to say that they don't get a complete healing experience in your office unless they actually speak out the benefits that they're experiencing and share that with other people in their lives. But like I said, that's a whole nother video. So do they realize it's important? Number two, do they know how to share their story? Have you taught them how to share their story, or do you know how to teach them to share their story? There's no shame in not knowing how to do that. But if you don't, come on, man, reach out to us. That's what we're here for. We will help you do that. And then the third is the story making an impact when they do share it. Those are important questions to ask. We'll dance with that just a little bit today. But like I said, if you're intrigued by this topic and you want to have a referral-based, self-sustaining, stress-free practice, which is what we do, then please reach out. Let us know. We're here to help you. So as your patient's doctor, as your patient's teacher, you must educate them. You have to teach them the value of what you're doing, and then how can they share that with those people in their lives that are important to them. So one of the ways we do that is gathering success stories. We call them, you might call it a testimonial, we call it a success story. Ultimately, it might go something similar to this. Patient, you're in the treatment room and they say, man, doc, I don't know what you did last time, but I just did so great. Or I haven't had headaches for such and such an amount of time. When the patient says that, you've got to stop and ask them, tell me what you mean by that. Tell me about that statement you just made. And have them tell you and explain to you their experience, right? Their story, the experience that they're having in your office. Celebrate that with them, get them treated, and instead of just sending them to the front, if that's your protocol, walk to the front with them and have Cindy at the front desk know that, hey, Dr. Miller's coming up with a patient. That must mean it's success story time. Have her have a clipboard ready with that success story blank on there so that the patient can fill it out. But before that, just have your patient, look, Mrs. Smith, Cindy up here at the front desk, man, she handles the phone. She's moving you patients around. She does such a great job, but she never gets to hear these stories unless you tell her. So if you would, please take a minute and share with Cindy that story you just shared with me. It's really, really cool story, and it's important. Cindy, this is a good one. And then boom, you head back to see patients. So Cindy will hear the story from the patient, from Miss Mary, and then Cindy will ask them to fill out the success story form. Sit down in the waiting room, fill it out. Now I know you're going, well, what if they refuse to do that? Look, that's all part of the protocol. There are ways to manage that. But ultimately, we want to get that success story filled out. There's 3 times in your office in the course of probably about 10 to 15 minutes, the patient has shared their story. They shared it with you, They shared it to Cindy, and they wrote it down on that success story form. So 3 times in just that visit, you've trained your patient on their story and how to share it, and the repetition of that. Then we typically have a wall in the doctor's office where we hang those testimonials, those success stories, and we frame them. We get them all lined up, man, with those laser level things. It's so easy to do that now, and it's powerful. Typically, we'll have that across, either in the therapy area or across from the hot seats where the patients are waiting to come in and see you. Again, that gets into a lot of detail, but if you've got a wall full of success stories, and every time you take a new patient out of your office, imagine, go with me on this, you walk a new patient up to the front after they've had day 1 with you, and there's a blank spot on the wall surrounded by all these success stories. I've even seen offices that shine a light on that spot, and it says your story goes here. But you pause and you just put your hand there and say, hey, look, I expect your story to be right here. 10 seconds of making a statement builds such a tremendous expectation for them. Number 1, you have an expectation that they're going to accept your care and they're going to come under care in your office. Number 2, you expect them to get better. And number 3, you expect them to share their story by putting it on the wall. It's a tremendous opportunity to have a huge expectation of your patients. How about when you're treating your patients? Do you educate them as you're treating them? I can remember times, we always have the ANS charts in our offices because that's the opportunity, or the nerve distribution chart, spinal nerve distribution chart. So you can walk a patient, maybe you get a particularly good set on a T2 that day. And hey, Mrs. Smith, come on over here. I want to show you something. We got a really, really good adjustment on that T2 today. Just follow that. That's the T2 vertebra right there. Follow that nerve. Yeah, that yellow, just follow that down. Where does that go? Yeah, it goes to your heart, goes to your lungs, it goes to your thyroid. That ticker of yours is going to be ticking better today and for the next very long time because of that adjustment today. It's important, and I wanted you to know that. Look, that's another way that you can be in the process of always educating your patients about the benefits of chiropractic care. We talk about wanting our doctors to be the go-to doctor in the community. What that means is because you're a doctor that treats a subluxation, that treats the spine, that does chiropractic care, the benefits are so numerous for that. Patients are very narrow in their focus. They're very narrow in thinking that I'm coming in here for migraine headaches, that must be what this doctor treats. So there has to be different ways for your patients to see that there's so much more than just migraines that you treat in the office. You got a wall full of success stories that all have different conditions. There's no better way than for a patient to be, number 1, overwhelmed with success, because every single one of them says success, and then get specific about the condition and what their story is as they've shared it there. Look, I've taken up a lot of time. If you have more questions, like I said, please reach out to us. That's what we're here for. It's just a tiny little bit of what the Align system and the AMC system can do to help you in your practice become a referral-based office that's the go-to doctor in your community. And Dr. Miller signing off. Have a great day. If you enjoyed this video, click the like button and share it with your friends and colleagues. AMC is here for your practice and your patients. Visit amcfamily.com to learn more or call 904-966-4996. See you next week.